Good morning, everyone. Sorry about the technical difficulty with the sound there. I am happy to welcome you to the department's budget overview, and we'll go through the agenda now. This is Lori Chris, and I'm happy to be here with you this morning. So, as you know, we'll be talking about Governor DeWine's budget priorities, just in brief, and then also dive more deeply into the department's budget highlights. We will have an opportunity to answer questions, and there is a box on the webinar software that allows you to submit those. And we'll be able to do that today, and then you'll be getting more detailed information as time goes on over the next few weeks as well. So first, let's start with appreciating Governor Mike DeWine and his leadership to create unprecedented resources for mental illness and addiction among Ohioans. I know that we here at the department have appreciated his leadership and also have received notes from a number of you across the state who have recognized his efforts to make sure that we have the resources we need for prevention, treatment, and recovery. This budget is based on the priorities of people with lived experience, family members, providers, boards, local communities and education, criminal justice, and child welfare partners. And it also has relied on the expertise of the team here at the Department of Mental Health and Addiction Services, Recovery Ohio, and the Office of Children Initiatives. A lot of what we were able to introduce as the administration was based on the Recovery Ohio recommendations and the Community Advisory Board. And so we were proud to do that. And we're also excited that the budget as passed really does look very similar, if not almost identical to what we submitted. So we're grateful for that. We look forward to what we will accomplish together for prevention, treatment, and recovery with these resources in the next 2 years. As the governor launched into his work and preparing for the budget, the primary areas of focus for him were workforce and innovation, local communities, recovery, children and families, and natural wonders. And the first 4 of these 5 really do land squarely within our work. So we were excited that he had that focus. When looking at our budget, it's comprised of several funding sources, including state and federal funds. You can see on this slide that our GRF resources continue to rise through Governor DeWine's investments in mental health and addiction services as one of his key priorities. For our department, I'm sure most, if not all of you are aware that our priorities are focused on early intervention and prevention, increasing access to treatment, breaking the cycle of crisis and the cycle of criminal justice involvement, and maintaining the quality safety net services at our state psychiatric hospitals. And so we'll be talking about those in more detail now. This budget invests in meeting people where they are to promote healthy relationships and resiliency in facing life's ups and downs. Prevention and early intervention are critical to a healthy state of Ohio and its citizens. And Governor DeWine and the state legislature prioritize prevention that can be applied in all of our homes, schools, and across our communities. One of the governor's top priorities is investing in K-12 prevention education. You will see that we have a partnership with the Ohio Department of Education, Recovery Ohio, and Children's Initiatives Office. And our prevention team is working collaboratively with these other parts of state government to build a framework for these resources that will engage partners at the local community level to plan for and deliver prevention services in K-12 classrooms. We also know that family and friends are the front lines of early intervention and prevention. Our department will build on the work of partners in the private sector who have market-tested prevention materials targeting friends and families to launch a series of statewide multimedia campaigns. Examples include the Family Dinner Project and Parents Who Host Lose Most. We know that children and youth are exposed to so much information that's outside of the messages emphasized by families and health and wellness lessons learned at school. And these campaigns will reinforce positive messages to support families and communities in efforts to help children be healthy throughout their lives. This work will be led here at the department by our public affairs team in collaboration with our prevention team. We'll also be expanding Ohio START, which is an intervention program that provides specialized trauma recovery services to children who have a parent with a substance use issue and are child welfare involved. The work includes focusing on assisting parents in their recovery and on helping children address the trauma that they've experienced in their young lives. Ohio START is currently in 34 counties, and our investment will help bring this program to an additional 30 counties. Funds will be coordinated with the investment that the Department of Jobs and Family Services also has for this program. And our Child, Youth, and Families team will be collaborating with the team at JFS and the Public Children's Services Agency of Ohio to administer the program. We're also expanding our efforts with early intervention and prevention for gambling addiction. We have some non-GRF lottery-related funds that will be supporting expanded efforts for prevention dollars to the boards and also for gambling brief intervention and referral to treatment pilot study. We're excited about these opportunities presented here, and our prevention team is leading that work. We have a number of initiatives that will be increasing access to treatment and gaps in the continuum of care. First, our budget seeks to do a thorough evaluation of the state's behavioral health treatment capacity with a one-time investment of $100,000. We'll use what we learned from this evaluation to inform strategic planning and address gaps in the treatment continuum caused by Ohio's behavioral health workforce shortage. We'll also be investing $8 million to help recruit, train, and retain quality behavioral health professionals to Ohio's system using a variety of proven approaches. Our department is currently planning our approach to this work, which will include training opportunities and direct grants to community providers to support recruitment and retention activities. Our policy team is leading this work. We know that citizens are an untapped resource in Ohio's behavioral health system. In addition to the professionals that work in the system, we know that there are a number of others in our communities who are on the front lines. And we know that many people would know how to respond if someone collapsed from a heart attack on the street, but it's frequently not the case for mental health and addiction crises. And we aim to change that over the next 2 years. The Department of Mental Health and Addiction Services will direct $5 million in one-time funding towards educating and equipping non-professionals with skills to recognize and appropriately intervene when someone is experiencing a behavioral health emergency. These funds will target faith leaders, librarians, law enforcement, and other citizens on the front line in supporting people in their mental health and wellness and knowing when and how to seek professional help when needed. As the state regulatory authority of community-based addiction and mental health treatment providers, we license or certify over 2,000 entities, including adult care facilities. Our department will direct funds toward improving our licensing and certification processes to streamline and strengthen our regulatory system so that more providers can move through the process more quickly while ensuring the safe and effective quality treatment environments for the public. A big focus of our stakeholders has been helping families and individuals deal with crisis. We know that crisis is cyclical for people with addiction and serious and persistent mental illness. And we know that families who are experiencing either addiction or mental illness for the first time also often find themselves entering the system through a crisis event. And we can and must create real opportunities for Ohioans to get the help that they need when they need it. We must end the cycle of incarceration, homelessness, and hospitalization for the men, women, children, and youth in behavioral health crisis in our state. To this end, the Department of Mental Health and Addiction Services is investing in additional resources for crisis services. Sorry, go back. And we're also continuing the previous investment in crisis services as well. So the allocations from the previous biennium for crisis stabilization centers for mental health and SUD crisis continue, and we have $8 million for crisis intervention services for families through the Strong Families, Safe Communities initiative. And this is a partnership with the Department of Development for families that have children and youth with developmental disabilities who are also experiencing behavioral health symptoms. Our new crisis investment is geared towards providing technical assistance to communities to ensure that responses are comprehensive and use widely accepted standards of care. Responses will be designed to meet current and emerging needs, such as the shift from prescription opioid abuse to methamphetamine abuse. We'll fill gaps in Ohio's crisis service network with locally determined responses, such as mobile response teams, crisis centers, integrated with a local hospital or behavioral health provider, or treatment services in jails. We'll also be using some of these dollars in flexible ways that can be used across both years in the biennium. And our community treatment and community planning and collaboration teams are working together to help support local communities in planning for and delivering these services. We'll continue our collaboration with the criminal justice system. I know that we at the department and the stakeholders across the state have built strong relationships over several years. And the increased involvement of people with mental illness and substance use disorders in the criminal justice system continues to grow and is a serious problem. Behavioral health interventions, treatment, and supports can be delivered along the continuum of criminal justice involvement, ranging from officers knowing how to de-escalate a situation when they encounter a person experiencing a mental health crisis, to connecting people to treatment and recovery supports through courts, during incarceration, or upon returning to the community from jail or prison. We will continue our existing investments in specialized dockets, and we'll also be adding investments to add at least 30 new specialty dockets over the biennium. And this was a primary goal of Governor DeWine's that we're proud to support in our budget. Earlier, I talked about the opportunity to support the citizen workforce, and we're specifically doing that as part of the $5 million investment mentioned earlier. We are investing some of that in expanded CIT training for communities who need expanded officer capacity or who haven't been able to participate previously in the state's training offerings. We did veto a proposal that invested in MAT in jails, and we did so because this was unfunded and would have reduced this existing funding to well-performing established community programs. There should be no mistake, though, that we remain committed to working with stakeholders to improve access to medication-assisted treatment in jails for people with opiate use disorders, and we'll continue to work with and create opportunities for that planning and implementation. And of course, the department has included in this budget an opportunity to maintain a quality psychiatric safety net for Ohio citizens. Governor DeWine and the Ohio legislature did maintain support for our current capacity of nearly 1,100 patients on a daily basis, and we're grateful for that support and recognition of this necessary level of care. There were a number of legislatively identified investments that we did not propose in our initial administration's introduction of the budget, and some of these were funded and some were taken from existing budget amounts. And so we'll be working over the next couple of weeks to make sure that we are planning for and implementing these newly identified opportunities and coordinating it with existing budget resources. So over the next month, you'll be seeing a lot of activity from the department related to these budget initiatives. This week, we're doing the budget recap, and we'll be making our white papers related to the budget available so that you have more detail on the initiatives that we included in our budget. Tomorrow we'll be co-hosting with the Department of Medicaid a stakeholder webinar, and that webinar will focus on BH redesign and the Department of Medicaid strategies to help stabilize the behavioral health system for continued access and capacity to services across the state. And it will also cover a number of other initiatives that we've been working on as a follow-up to our May 29th in-person and webinar session. Next week, you'll get an e-update with a budget recap article, and then the week of August 12th, we'll be putting out to the community much more information on the continuing funding from previous investments. So there will be more detailed information for those of you who have initiatives that were previously funded that will be continuing in this budget. And by the end of the month, we will have more detailed information on the new funding and programs that we're implementing through this budget. Through all of this work, we are looking forward to partnering with all of you and the grantees and communities receiving allocations for more data and accountability. It will be a priority for us so that we can measure the impact of programs and services and communicate the value of the investment to Ohioans. And our quality planning and research team, along with our program staff and IS team and finance teams, will all be working together to support this work and to support collaboration with our community partners in making sure we document the true value of these investments for Ohio. And so with that, I'll see if there are any questions that have come in, and happy to answer those. This PowerPoint and a recording of this session will be posted on our website by tomorrow at the latest. So there's a question about the crisis funds and the use of those dollars. We are looking at the crisis funds as continuing investment from the previous biennium, and the language in the budget was a continuation of the previous language. So those investments will be managed the same way. And then there's also new investments, and we're working on how those will be made available to communities throughout the state, and more detail on that will be coming. But we don't look to have it as specific as the previous and continuing funds that are represented here in the $15 million. There's a question about the TMS pilot, transcranial magnetic stimulation pilot, which is to support veterans in their recovery from PTSD, and whether or not the grantee has, or the recipient of those funds has been identified. And we're working through those details with the legislature, since this was a legislatively identified priority, and with Veterans Affairs. They're a partner in this work as well. There's a question about the prevention education funds and whether or not they're specific to substance use disorders, or if they're inclusive of mental health prevention and health promotion as well. And we know that good prevention really is mental health promotion. And so these dollars will be used to positively impact the whole development of children in their mental wellness and preventing their substance use in the future. There's also a question about the K through 12 prevention for more detail on how boards will work with local communities. We are working with our partners at the Department of Education, Recovery Ohio, and the Office of Children Initiatives to finalize the details on how these resources will be made available and support collaboration at the local level. So that's information that will be coming over the next few weeks. There's a question about whether or not the additional 30 counties for Ohio Start are identified, and they have not been identified yet. There's a question about whether or not prevention education will be limited to only certified prevention providers. And I'll say that, at the state, we have a dedication to making sure that we deliver evidence-based quality services and are putting together a framework that will support this and that values the workforce that's available and the programs that are connected to us here at the Department of Mental Health and Addiction Services through licensure and certification. There's a question about whether or not there will be more information available about how early identification and prevention work together. And yes, we are diving into that work so that we can recognize the full continuum of prevention, early identification and intervention, treatment, and recovery, and doing so across the lifespan, not just K through 12. So more will be coming on that work and how to deploy it effectively across the state. People are asking about the webinar tomorrow with the Department of Medicaid, and it begins at 11 a.m. It's a webinar-only participation. It begins at 11 a.m. Information went out through Mitspitz and through the BH Redesign newsletter, and our department will put that information out again following this webinar so that everyone can access and register for that if interested. We're continuing to sort through some questions here and give consolidated answers. There was a question about the investments that the Department of Education will have for mental health supports in schools, and we are collaborating with them on that work. And those dollars are Department of Education resources, and so we'll be working with them, but they will be managing those resources and communicating with the communities on that. So those are the highlight level questions that we've received. There are a number of specific questions about RFAs and eligible recipients of funds that we'll be providing more detail on over the next few weeks to a month. And some of them, the questions will be answered in the white papers in more detail as well. And so watch for all of these resources. Please stay connected to us through our eNews Now. And again, this webinar will be posted on our website, and also on a recording of this will be posted on our website as well. If you have additional questions that you'd like answer as time goes on, please email them to statebudgetquestions@mha.ohio.gov, and we're happy to answer those for you. And OBM also has a number of budget white papers that they have posted, and those are a good source of information from the administration too. So thank you to all of you for participating today. I know that we'll have a number of opportunities to interact over the next several months as we roll this budget out together, and look forward to working collaboratively. Thank you.